IPR Healthcare System Incorporated, of course, is a home health agency, and we provide services like nursing and therapy services and home health aid services also. We have over 100 employees now, 400 patients. A very large agency, very large. Without Kinnser, I do not know how we are going to operate.
It's everything that I do. I wake up in the morning, I get on my email, I go to Kinnser, I find out what my patients did yesterday if a nurse was at a patient's house. If I'm scheduled to see a patient, I can look on there and see, it'll actually say from the nurse, you know, don't go see so-and-so today because they've got a doctor's appointment at 2 o'clock. If you're going to go before 12. Those are things that I wouldn't have got during the night, but the nurse that sat down to do her notes put them in Kinnser, and I was able to read it first thing in the morning, so then I can reschedule my visit.
We can also do the scheduling of these nurses, and also therapy. We can see everything right away, and everything is done so fast. That is why we do not have any problem as far as compliance with these regulations. The conditions of participations are always met.
Using Kinnser makes me feel like it's who I am as a therapist. I go in to see a patient, and if there's any vitals that are different, or if there's anything that I feel a nurse needs, or if they need a bedside commode or they need a wheelchair, instead of constantly calling the office and leaving a message for somebody, I can just get on Kinnser and I can log in and say, please order this for this patient.
There is a message in our inbox or K-box that will tell me ERN ready to view. And so all I have to do is to go ahead and open it, and it's just, again, another amazing thing. I just have to check which ones were paid from our claims, and then just go ahead and post it. I think this is the easiest software ever.
I tell my physicians, we have a website and we have a software that we use, and I tell them it's Kinnser, and we're able to communicate. We don't just admit your patient and then a nurse goes out 3 days later and then therapy goes out a week later. We're actually able to get that referral over. It's put in Kinnser immediately. Then it's sent out to everybody, so that if I have one of my doctors that have 3 orthopedic patients coming out on Friday, we get the referral on Wednesday. It's already put in Kinnser that these patients are coming out of the hospital, so we can go ahead and plan for the therapist that's going to see them on Monday. And it just makes everything work so well together.
It is really like a heavy interaction with one another just using Kinnser alone. Yeah, that is the life of IPR. Kind of a bloodline for us.
When I tell you that I don't know what I would do without Kinnser, I honestly mean that. It's my calendar and my book that is my Bible, and without it I have no idea what I'd be doing. I don't know what I did before it. That's amazing, but I don't know what I'd do without it right now, honestly. And I don't ever want to know what I do without it.